Hi, everybody. We are at week 6 already. It's hard to believe that we have made it through weeks of the semester. Announcements for this week. Let's see. Please remember when you go into a student's room to make sure that they have taken the chemical indicator out of their cassette and it's laying next to the cassette so that it does not so it doesn't run through the instrument washer. This is especially important for first year students because we're still finding those left in the cassettes. When you complete a skill evaluation, please only use twos, ones, and zeros on the little lines for each of the criteria. So we're asking that you please don't use X's or check marks or initials, but just a 2, a 1, or a 0 on each of those little lines. For SARP, under the services area where students are checking off what was completed on the patient, just to provide a little bit of clarity. If the service was done on the patient, then it should get checked. So let's say the student did the service like perio charting, but they didn't get to check in that day. They would still check off that perio charting had been completed. Let's say that the patient was in for their second appointment and the faculty member did a check-in. So the faculty member did the perio charting that day. It should still be checked off even though the student did it last time and didn't do it today, because that service was done at that appointment, even by the faculty member. It should get checked for that appointment. If you have any questions on that, please just reach out to one of us. Earlier this week, Nicole sent out the email for your suggestions for clinic forms and goals. So please, when you have some time to make those suggestions, please do so. Okay, things for first year students. This is their second week with real patients. I anticipate you'll be seeing some more skill evaluations this week than we had last week. I'm also noticing that the students are moving at a little bit of a slower pace in clinic, and I think that's okay. They really seem like they're taking their time to learn the forms and the paperwork and to do things correctly and to build their skills. So I'm happy with the pace that they're at right now. I think, within a couple of weeks, we might start encouraging them to work on time management. But for right now, I think they're where they should be. Reminder that first year students cannot scale class 3 patients yet. So if the first year student does an assessment and it turns out that their patient is a class 3, that's okay, but the patient cannot be reappointed for the scaling services until after spring break. So if someone comes out as a 3 in the student's chair, be aware that the second appointment or the scaling appointment is going to need to be scheduled after break. For second year students, they are having their clinic mentor meetings this week. So the second year faculty mentors for second year students are Jen and Jill. So they'll be getting all the students through those mentor meetings. At those meetings, they talk to the students. The faculty looks at the student's binder, sees where they're at in the semester, how many patients have been completed in each of the categories. They look at the number of skill evaluations that have been completed. So they check in to see if things are progressing the way they should be in clinic. They also will offer advice and suggestions as needed. Second year mentors also check in to see how the didactic courses are doing to make sure that the students are at least a 75% in those courses. And if they are not, that they have reached out to the instructor. And they also check in with them to see what their study plan is for boards and are making sure that they are doing something weekly at a minimum to help prepare for the exam. Second year students should hopefully find their STM patients by the end of this week if they have not already done so. If they don't find one by the end of this week, it's not an absolute emergency. There's still some leeway with the time, but it is certainly preferable for them to have found the patient by the end of this week so that they can sequence out the rest of their care. those are all the updates I have. Once again, I hope you have a wonderful week. And if you need anything or have questions, please feel free to reach out to any of us and we'll be happy to assist.